parent that knows deep within themselves that there is something different about your child's bowel movements, but you've been told that they're normal or that you're overthinking them? Does your child have trouble laying on their back without their little bellies cramping? Does your child become irritable or fussy and you've been told that it's because of teething, when you know that it's not, they've just teethed? Have you noticed skin rashes or redness or welts on your child? Then keep watching, because in this video I'm going to share with you some of the most common symptoms of MSPI in children that most people are not aware of. Now, most people are not aware of the MSPI or the symptoms that it can create. Now, MSPI stands for milk soy protein intolerance, which means the inability to digest the proteins found in cow's milk and soy products. Now, this is not the same as a lactose intolerant. MSPI is the intolerance to the actual milk protein. Lactose intolerance is a deficiency in the enzymes that break down the lactose, which is the major sugars found in both cow's milk and human milk. These two conditions can often be confused as their symptoms are similar. Feeding lactose-free formula or food doesn't help a child with MSPI, as it still contains the cow milk protein that causes the symptoms. Now, it's very important to know that anyone can develop intolerance to cow's milk or soy proteins. It doesn't matter if you're breastfed or formula fed as a baby. As many as 2 to 7% of babies under the age of 1 have an intolerance to cow's milk, and 60% of those babies will also develop intolerance to soy proteins. Children with MSPI may cry 18 hours or more a day. They may experience weight loss, congestion, repeated vomiting, reflux, aching, screaming, pain during eating. They may be vomiting more than normal. They may have certain skin rashes, cradle cap, eczema, angry red rashes, diaper rash. They may also show changes in their appetite, including refusing food or not wanting to eat all the time or wanting to eat all the time. And you may find blood or mucus in their stool. Now, I know how mentally challenging, isolating, frustrating, and overwhelming it can be to see your child go through these symptoms and not know what is causing it. Now, both of my children developed MSPI along with other food intolerances and food allergies. It took us and the doctor 7 months until we were able to diagnose my eldest son with MSPI after months of pain, confusion, heartache, and invasive testing. And then later, it took my daughter 3 weeks. So she was only 3 weeks old when we started to identify the symptoms, and she was also diagnosed with MSPI. Now, in summary, so many children with MSPI are diagnosed incorrectly because most people are not aware of the common symptoms, okay? The blood and the mucus in the stool, the skin rashes such as cradle cap, eczema, and, the constant diaper rash, the vomiting, the reflux. So very often they will get misdiagnosed as something else. Now, comment below and let me know what stood out from you in this video. And if you have any questions about MSPI symptoms, comment them below. Thank you for watching. Bye for now.